Okay, so I'm glad to see that most people are back in the room. I'm sure others will be streaming in shortly. But to make sure that we stay on time and we have equal time for both discussion and speakers, we're going to get up and started again. So what I'd like to introduce my colleague, Rose Martinez. She has been the director of the Health and Medicine Division's Board on Population Health and Public Health Practice at the National Academy of Sciences since 1999. The board has a vibrant portfolio of studies that address high-profile and cutting-edge issues that affect the public's health. The board addresses the science base for public health intervention and examines the capacity of the health system, particularly the public health infrastructure, to support disease prevention and population health improvement, including the education and supply of health professionals necessary for carrying them out. And Rose is going to introduce two of the committee members who served on this report that we keep referring to. So this was the first consensus study that was released on January 11th. January 25th is throwing me up. That's today. This is the presentation. So let me bring Rose up.
So thank you. First of all, I'd like to thank the Robert Wood Johnson Foundation for providing the opportunity for us to conduct this important work. It's really been an honor and a privilege to work with the committee members who gave of their time and their expertise to prepare this report. Dr. James Weinstein, President and CEO of Dartmouth-Hitchcock, and chair of the committee, sends his regrets. Unfortunately, weather kept him from being with us today. But we do have two members of the committee who will present the report, and I'll ask them to come up. Dr. Allison Evans-Cuellar. She's professor of the Department of Health and Health Administration and Policy at George Mason University. And Dr. Helene Gayle, CEO of the McKinsey Social Initiative. Come on up. And so both Allison and Helene were vital to the development of the report's conceptual framework. Both could be counted on to always bring the committee back to the full landscape of the challenges for achieving health equity. Allison's guidance on the larger policy issues that can both hinder and uplift communities was essential, as was Helene's ability to always help keep the committee focused on the conversation on how to improve health equity and not just health. I want to just give you a couple of statistics in terms of how the report has been distributed. On the day, on January 11th, the day we released the report, we had about 420 people on the webcast with us. There was a thunderclap that was organized with the help of RWJ. There were 1.2 million Twitter users who were using the hashtag Promote Health Equity. And it actually trended that day, which was a big deal because the release occurred at the same time as the president-elect's first press conference. Since January 11th, the report has been downloaded more than 4,050 times. It's been downloaded in every state and in DC and in 112 countries. So it's getting a wide dissemination. I also wanted to, just before I turn it over to Allison, to acknowledge Gretchen Musikant. If you could just stand up. If you're back, no? She will be speaking later this afternoon. Trisha Chakrabarty. She's representing the Mandela Marketplace, which is one of the community initiatives highlighted in our report. And Michelle Roan Collins, I know you're here, great, who is a member of the Magnolia Community Initiative. So I do hope that you will have the opportunity to chat with them about the activities at their community. I also want to acknowledge Amy Geller and Alina Bachu, who were the staff who supported the committee in their work. And with that, I'm going to turn it over to Allison.